Good morning, everyone. Child Psychology. My name is Nadeem Sikander. dr.nsikander@gmail.com is my email address. I do receive emails asking questions, but I have to tell you that not every question is that I've been able to answer, just to be clear on that. However, I have people, colleagues, people who have worked with me. They're in different disciplines. We usually ask them the answers. I don't prescribe anything. I try to keep, this is more of an overview of child psychology. This is to promote understanding how children develop, the cognitive development, the social emotional bonding, and so on and so forth. So the parents are well aware of it when raising their children. And when there are questions that are more clinical in nature, what should I do? I usually ask them to, really reach out to the school psychologist or local CBD department, or areas where the children can get some sort of a help if they are needed. My area is more of educational side of it, and I try to help parents understand what their rights are as far as their kids' educational rights are concerned, where IEPs are involved, where 504 accommodation plans are involved, wherever we can find help to make sure the children continue to learn and not to lose learning, or not to miss learning because we are unable to provide them the support. So we try to do our best to provide that support. And my age range is dealing with children is very broad. I have all the way from the infancy area down to middle school, and then high school all the way to college age is what I do, since I'm a state chaplain as well. So I do a lot of that along with my own credentials. And let me get to the actual, so I just wanted to throw out a disclaimer here to make sure that when you're asking a question, I can find you some help, I can give you some avenues, I can try to answer the questions on the areas of what I know, what I have been, my own learning has been. So my own area has been the educational part, where we've been leading schools and providing all sorts of social emotional behavior support to children in schools, and finding them the help that we are unable to do so. Let's see what we are discussing today. So today's module is module number 14. We're going to cover a lot in the next, total are 22 modules, and we are on module 14, attachment and relationship building. Now we'll be looking at relationships in earlier life of the child, who they're going to develop this relationship with first, right? Obviously, then that would be the parents, and learning about the attachment theory and relationship between love, support, and security, as well as the attachment and relationship, how all that help prepare children for life. So what is known is this: relationships are recognized as one of the most integral part of child development. So that goes without saying it. So the way the child first relationship is, or will be, or he or she is experiencing, it plays a huge role. It's a proven to impact how the child is going to be grow up to be. Okay, so how they participate in relationships with other people, like friends and colleagues. So in this module, we'll be looking all that. The importance of early relationships. A child's most important relationship is in their first relationship with their parents, as well as the relationship with the siblings, immediate family members, and other caregivers. For example, your child is involved in a daycare, for example. People, they needed to know that what their interaction is. So when your children go to daycare, for example, make sure there is make sure your children are well taken care of. Okay, let's put it this way. I don't want to throw alarms out or alarming you, but I can tell you, not every daycare is meant for your child. Okay, maybe there is not enough good chemistry. Maybe there is something else. If your children are not getting the care they need earlier part of their life, in whether at home or from the people around, or they're going to the daycare, it's going to impact them. So these relationships are essential for development, because the child uses these other people that I just mentioned to learn about the world around them. So you want that your children to learn about the world around your child to be a better world, then you must give them, and you must vet all that. You must find out where my child is going, who my child is going to interact with, right? And I'm not saying to play like a super cop on your child, but make sure the children are in a caring, a nurturing environment, when they're, especially when they're young, as well as they move into the school age. So, discussions are open. So this system of learning is why many psychologists believe that the love and warmth are so important, my friends, for building relationships and connections with children. Okay, so you don't want to miss that. The support children have earlier in life, this demonstrates a positive behavior. Okay, so the demonstration of positive behavior, it helps them deal with problems and stress later in life in a way that is healthy and socially acceptable. So you want your children to have a great experience in life? Well, it starts very early. Let's get to the attachment theory. So attachment theory is the prominent mode of analysis used to describe and promote the emotional bonds or relationships between parents and children. According to, and it's really interesting, I think we mentioned John Bowlby's work. According to Bowlby, the creator of this theory, when a parent-child relationship is secure, a child is better able to do what? 3 things. Deal with stress and keep negative emotions at bay, explore the world around them confidently, and continue to push forward their development, whether cognitive as well as emotional. So keep that in mind. If your children are having a good experience with you as parents, then know that they're going to deal better with stress and negative emotions. They're going to actually explore the world around them carefully. As Dr. Peterson says, he says, allow your children to do dangerous things carefully, right? I don't want to get into that too far, but too deep in that, but I think you're getting the picture. So continue to push forward in their development. So they will continue to move forward and develop better and better. So attachment transitions through 4 stages. Infant begins to respond to anyone who offers affection and contact. The infant behavior becomes discriminatory and directs certain behaviors like crying and cooing toward specific people. And the infant develops an active attachment. Infants are anxious when they are separated from primary caregivers. Both the infant and the caregivers begin to influence one another's behavior. So the development of attachment is measured through the strange situation procedure. I'll talk about it, the strange situation procedure. It's very interesting to watch. I think it's available on YouTube as well. But in this procedure that I'm going to mention in future slides, the infant is separated from their caregivers, okay, from their caregiver, and observer documents their reaction upon being reunited. So the infant is going to be separated from their parent, and then infant will be able to see the reunion, and then the observer watches the whole thing. Now, this is the procedure. The procedure is episode 1, scene number 1. caregiver, baby, and experimenter. This experience lasts less than a minute. In episode 2, caregiver and a baby are left alone with child playing. Okay, so the parent leaves the baby alone while the child is playing. A stranger joins the caregiver and the baby. Okay, the caregiver leaves the stranger and the baby alone. So as a parent, you leave the baby with the stranger alone while the baby is playing. The caregiver returns and the stranger leaves. Okay, and the caregiver leaves, so the baby is left alone. And the stranger returns. The caregiver returns and the stranger leaves. So these are the 8 episodes, right? So in this entire episode, in these 8 episodes, in these 8, you can say, scenes, that what you're looking at is infants who are close to their parents. What we are observing out of this experiment or of the study is to see the infants who are close to their parents or caregivers and are anxious when they're separated, right? So an infant who's playing and a caregiver is there, a parent is there, the parents leave, and the caregiver and the child is left with the stranger in the room. When the parent returns, the child is anxious because of the separation, but he or she is relieved when they're reunited. And this is considered to be attached. Alternatively, if a child and a caregiver are reunited, at the end scene, they're all reunited, the infant still inconsolable and continue to cry when reunited with the caregiver. In this case, he or she is considered to be insecurely attached. Okay, you see the difference? In one scene, the child calms down, parent is there, hug and kiss and all that stuff. The baby is calm. In the other scene, the baby is not calm. If the baby is not calm, the baby is insecurely attached. In the first scene, the baby is securely attached. So attached versus insecurely attached. So, but just to make things clear, things are not always black and white in the attachment theory, right? Children are always either attached. It is not necessarily that they're always are always attached or unattached, right? So there is a disorganized styles, right, also occur. For example, if a child experiences distress, right, and proximity upon being reunited, they might be labeled with disorganized attachment. Right, so the caregiver returns and the baby is not necessarily calm and consolable, because if the parent is there and the baby is not attached, that's not the case. It could be the issue of proximity upon the parents or the caregiver's return, or there is other distress the child has, right? So that's what I said. So this can consider to be the disorganized attachment. Okay. So 3 different levels that we talked about. So children with disabilities, for example, someone with Down syndrome, autism, they indicate more of the pattern in which there is a attachment issue. So infants and children with severe disability may see delays in their ability to reconnect or demonstrate attachment. And the combination of the delays or different behaviors with the common feelings that parent that many parents of children with disability can have different results in terms of the attachment process. Parental role in attachment, the 3 patterns of attachment identified: secure, insecure, disorganized. We just talked about it. And obviously we mentioned that can fluctuate through the development process. A child who's insecurely attached, right, there's a possibility a child who's initially insecurely attached may attach later in life, okay? And the child who is securely attached may find to be insecurely attached in future, okay? Because it does happen often in the case of children with disabilities, but what we're saying is things can be fluid. Things do change. Not to miss the part where parental factors are primary influence in the categorization of a child. So, for example, when a parent demonstrates support and acceptance, right, of a child and is willing to be sensitive about the child, or willing to play and give time and is there for their children or for their child, there is likely a chance, more likely to be that he or she will be able to instill secure attachment in the child. So if you feel your child is insecurely attached, you can work towards it to make sure they are securely attached. You can overcome that, but it takes obviously the care and the connection and the time that you need to spend. On the other hand, issues like insensitivity, neglect, domestic violence are often strong indicators of disorganized or insecure attachment. So remember that when there's a domestic violence, there is an argument, there's a fight taking place, there are issues, there's a neglect, there's an insensitivity. It's all about me and you and husband and wife, and the children are facing and watching the whole, prime time happening at home. Obviously, this is going to affect them, right? There's no reason not to see this coming, right? They are going to be affected. And in that case, well, they're going to be either insecurely attached with you or they're going to be disorganized. Well, this is a fact. A relationship with family members and other close relatives are critical to the healthy development of child. Children use family members and other close relatives to learn more about the world around them and model certain behaviors as they grow, right? So carrying childhood relationships through a lifetime, understanding peer relationships through childhood and into adulthood is complicated. It is not simply the matter of being accepted by the peers or rejected by the peers. Instead, psychologists can look for personal characteristics that are associated with the acceptance or rejections. So there are personal characteristics that also play that can indicate psychologists that they're associated with the acceptance or rejections. So, the formation of friendship, for example, begins at the age of 18 months and 36 months, depending upon the child, right? While a toddler concept of friendship is limited, some psychologists believe that the friendship and play are essential, right? Even if it's limited, they believe that this is essential during the period because child who succeed in these periods of having to have these friendships, although they're limited, but they're very critical. And it gives children the pro-social behaviors once they entered in school age. Additionally, the positive experience of these years transfer into higher likelihood of positive social experience once they reach school age. In conclusion, folks, preparing a child to enter the world and to relate to others begins in infancy. We mentioned this previously in many of our slides, that if you want your child to make sure that he's securely attacking and attaching himself with the world that's out there, it's not always that being not knowing and being naive about it. It's just like children are getting to this attachment to their parents. It begins as I said, in the infancy. An infant's attachment to their parents often a marks strong indicator that they have to support and love. They need to be entering into the world confidently and having peers among and social groups and so on and so forth. So they're going to encounter social groups and peers, but it all starts at home. Thus, although there are many theories governing child development, many continue to rest upon the earlier years of development. No matter what theory you look at it, right? No, it doesn't matter. It does not change a bit. You just need to know the earlier part of children's life, the infancy, is a very critical period of their development. And the love and the support that they will receive at that age from the earlier child life, it'll go a long way the days to come in their life. So thank you all very much for watching. I hope you enjoyed the session. Once again, dr.ncandor@gmail.com is my email address. Have a wonderful rest of the Sunday. We'll see you next time on module number 15. Thank you. Take good care.